Hello everyone, welcome to our webinar. We're just going to wait a few more moments to allow everyone to join us, but I just wanted to start off with saying that my name is Jordan and I'm part of the team at Canadian Fertility Consulting, and I'm super happy to be here with our speakers today. I just want to thank all of you who are taking time out of their day to be on with us. As we're really excited to talk to you. We are happy we're all able to gather online to discuss surrogacy and egg donation in Canada for all international intended parents around the world. We have 3 speakers and a few special guests with us. We have Ellen Embery of Carbert Waite LLP, Dr. Rahi Victory of Victory Reproductive Care, and the owner and CEO of Canadian Fertility Consulting and Egg Helpers, Leah Swanberg. And our special guests include Roycine and Sarah. They're going to be joining us a little bit later on during the webinar to talk about their experiences of being a surrogate and an egg donor with CFC and Egg Helpers. Now, before we get started, I just wanted to point out a few more things. This information being discussed is accurate as of today, February 18th, 2021, and we recommend that you still consult with your clinic and your lawyer on any of the information provided in today's webinar. And we're also encouraging everyone to please send in your questions using the questions tool. At the end of the webinar, after everyone spoke, we will be doing a live Q&A session with all of our speakers. So please, anything that you'd like to know, please send it in. And now I will invite Leah Swanberg on screen to join us.
Hi everyone, as Jordan mentioned, I'm Leah Swanberg and I am the founder of Canadian Fertility Consulting and Egg Helpers. And today it's my great pleasure to have you hear from amazing partners in the industry, Ellen and Dr. Victory, who will really dispel myths, share with you how surrogacy in Canada has become such a viable option for international clients as well as people across Canada. It has been a pleasure of mine over the past 15 years to work with clients from around the world and have been just so amazed by the professionalism and care that both Dr. Victory and Ellen and the rest of her firm have had for our clients. So at this point, I'm going to turn it over to Ellen to begin to share on the legal process of surrogacy in Canada.
Thank you very much, Leah. And I think my webcam is working, if somebody can confirm that.
It's perfect.
Wonderful. Thank you so much. And thank you for being here today. My name is Ellen Embery, and I'm a lawyer. I've been practicing surrogacy and fertility law in Canada for 15 years. And in that time, I've done thousands of surrogacies and egg donations. The best part of my job is when a client comes back to me 2 years after having a baby or 18 months later and says, Ellen, we're doing it again. Our surrogate has decided to carry for us again. And that happens a lot. And it's because, in my experience at least, the relationships between surrogates and the intended parents are real, which makes me happy to see. And as a lawyer, it's always nice to be happy because we don't get to be happy all the time in the legal profession. In the 15 years that I've been doing this, we have seen a lot of changes in Canada. From a legal perspective, Canada is a welcoming and a safe country in which to have your surrogacy baby. And all of us who are participating on this webinar are very proud of that. I know that this is an expensive process for you. I know that it might seem like a scary process. And I know that you probably really want to be able to have a baby in your home country, but for various reasons, you're not able to. Understanding that that is where you are starting from, our goal, certainly my goal as a lawyer, is to make this process simple for you and comforting. We want to be with you and give you the assurance that surrogacy in Canada is safe, it's simple, and it can actually be quite an easy process. There will be ups and downs. It is a human process, but the important part is to have a team that supports you. And I hope that you'll find that on this webinar, there are a number of people, portions of the team, and that's their focus. I've got about 8 minutes to give you a general overview of the legal process of surrogacy and egg donation in Canada. I want you to have useful information, and so having done many introductions and introductory calls with clients, what I'd like to do is essentially hit the top 6 questions that most of my clients ask me about surrogacy and egg donation in Canada. The number one question is always, what will my baby's birth certificate say? The answer is that if you are a same-sex couple or a heterosexual couple, the birth certificate is going to list the two of you as the only parents of your baby. If you are single, the birth certificate is going to list only you as a parent of the baby. It will not list the surrogate. There are various ways of getting there, depending on which province in Canada your baby's born in. And we probably don't have time today to go into all of that, but there is some information on my website which can assist you in that regard. So question number 1, will I be on my baby's birth certificate? Of course you will. Question number 2 is usually about reimbursable expenses. So what does the concept of reimbursable expenses mean? In Canada, your surrogate is not paid to be a surrogate. She has to submit receipts for her egg donate or for her surrogacy related expenses, and your egg donor has to submit receipts for the egg donation expenses. Realistically, your egg donor will be given a maximum allowance and she can submit receipts in that allowance, and the same thing for your surrogate. So we have government regulations around what is reimbursable. It is watched, it is careful, and it is not about profit. And that's really the framework of surrogacy in Canada. And frankly, I think that it's one of the reasons that we go back to this idea that there are real relationships between surrogates and intended parents. The third question that I always get asked, and this one makes me laugh, is how long do I have to stay in Canada after the baby's birth? And it always makes me feel a little sad because Canada really is a lovely place. And so we'd love to have you stay for a month or 2. But the reality is, of course, you want to get home with your baby. The time frame that it will take to get your birth certificate and your child's Canadian passport is going to be a minimum of 14 days from the birth or the date of discharge from hospital. So 14 days after baby's discharged from hospital, up to a maximum of about 1 month. We do get asked if COVID is causing delays in the post-birth process. For the most part, the answer is no. And of course, my hope is that for everybody on this webinar who's starting out, COVID will be a thing of the past by the time your child is born. So the time frame, remember that, definitely have to be in Canada for 2 weeks after the birth, up to about 4 weeks after the birth. And remember that your child will be a Canadian citizen with a Canadian passport by virtue of being born here. Question number 4, are there some provinces that are better than others? That is there are practical perspectives, there are cost perspectives, and there are legal perspectives. The reality is that most, but not all, of Canada's fertility clinics, which are specializing in surrogacy and are comfortable with surrogacy, are in the province of Ontario. You're going to hear from Dr. Victory today, and of course, he's in the province of Ontario. Most of my clients tell me that for various reasons, they would like to have a surrogate in the province of Ontario. From a legal perspective, what I can promise you is that both of you as parents will be able to get onto the birth certificate in every province in Canada where surrogates are located, with the sole exception of the province of Quebec. If your surrogate is in Quebec, Quebec is a fantastic opportunity for you if you are a single parent. Usually with couples, they may not prefer Quebec because they may both wish to be on the birth certificate. But sometimes, depending on the laws of your home jurisdiction, you only want one parent. If it's a same-sex couple, you may only want one of the fathers on the birth certificates for reasons related to parentage in your home jurisdiction. All of which is to say, there is no, from a legal perspective, no jurisdiction is better than another. We can always guide you and direct you with respect to which province is going to make the most sense for you. And again, on my website, we've actually just posted an easy to follow list of the differences in each Canadian province. Those differences have been upgraded in the last month because we have had a couple of changes in the law recently in the provinces of Manitoba and Saskatchewan. Question number 5 is always, well, question number 5 is one that I always ask because intended parents don't necessarily think about it, but it's related to healthcare costs for your baby. In Canada, your surrogate's healthcare costs are covered by her government insurance. Your baby's healthcare costs are not. You will have custody of your baby from the moment of birth, and because your child is not a resident of Canada, you will have to pay for your child's healthcare costs. As a result of that, it's going to be important that you have insurance to protect you against the risk of healthcare costs. I spend a lot of time dealing with insurance issues. We have, again, information about this on my website. My partner and I talk about insurance issues with our clients all the time. And I would encourage you just to be aware of that there are insurance products available. CFC is very well aware of them, and it's just something to have in mind. The last question that clients ask is there any chance that the surrogate could try to keep my baby? The legal answer is there is no chance that a surrogate would be awarded custody of your baby in Canada. As I say, we do thousands of surrogacies, and we've never seen a surrogate try. In order for a surrogate to qualify for the various programs, she's going to have psychological counseling. There are checks and balances in place. And there are laws in each province which are designed to prevent this. And so when we say very, very sincerely that Canada is a safe place to have a baby, we mean it. And so there's very little, I would say little to no risk that could happen. I have to say little because I suppose theoretically we can't stop somebody from trying, but again, we've got mechanisms built into the contract to ensure that it doesn't happen, and we have never seen it happen. I don't want to end on a low note because that is a little bit of a low note. I think that I want to go back to where I started, which is that Canada is a safe, wonderful place to have a baby. And the proof is with the amount of clients that I have coming back to me saying, guess what, we're doing it again, we're having a sibling. I want to simply leave you with, I am here, I'm happy to talk to you. It is important to me that you feel comfortable in this process. And I'm happy to set up a time to go through your personal questions. If you're interested in booking a consult, my law partner and I, we do not charge for consults because we want to make sure that you feel comfortable, that you understand what you're getting into as you approach a surrogacy journey in Canada. The website is www.canadafertility.law, and I believe that Jordan will be posting a link to that. There's lots of other information there as well. So I very much look forward to talking to you. My team looks forward to talking to you. And what I would like to do now is introduce Dr. Rahi Victory. Quite often when clients come to me, they ask me medical questions, and the inevitable answer is that I'm not a doctor. You need to talk to the doctor. And so I'm pleased to hand it over to Dr. Victory now, who can answer who can talk to you generally about the medical side of surrogacy in Canada.
Thank you very much, Ellen. I appreciate that intro. Hi, everybody. Thank you for having me here. I'm Dr. Rahi Victory. I'm a Canadian-trained OBGYN and infertility specialist. I actually went to the United States and did 3 additional years of training after I was done my OBGYN in Canada, so I could help patients have a family and develop the tools necessary to guide them through that journey. I like to say I'm a little bit different from the norm out there in that I'm very hands-on. I like to do a really good job of getting to know my clients and our patients, and I typically will spend about an hour with any couple, whether you're or single individual, and that's regardless of sexual orientation or, again, whether you're one person or 2 people. So we spend a lot of time to really get to know you. I need to know sort of what your goals are. We want to know how you arrived at this journey and why you've chosen to do it in Canada. And then we spend a lot of time going through each and every step of the process. And obviously you're aware of this already, but there are 3 really critical steps to the journey. So step 1 is making sure that we've tested you as intended parents, making sure that everything is okay. Step 2 would be making sure that the donor is okay and that there's no mismatch, whether it be genetic or sexually transmitted diseases and so on. And then step 3 is making sure that the surrogate is excellent as well and that they're appropriate and healthy and ready to go for you guys. And that's where our partners at Egg Helpers and CFC come in. And along the way, of course, Ellen and her teammate Rachel are outstanding at helping us with the legal aspects of that journey as well. So it's all kind of integrated. We're one big happy team all together. So my part really is starting off the process of the medical aspects of this and addressing your medical questions, but really being extremely careful and cautious to make sure that every single step of the way we are ensuring your health, the health of the donor, the health of the surrogate, and of course, most critical, the health of your offspring as well. And we want to make sure that we're going to have a positive outcome and a healthy outcome. So the common questions we get asked are, first and foremost, where does this happen? And in the new age of COVID, we can actually manage cases anywhere from anywhere. But for the actual testing, I can do it in Toronto or I can do it in any other province. It doesn't matter. We can do it in Ontario. There's multiple locations for us in Ontario. And outside of Ontario, we find partners that can help us for testing. For the actual treatment, we have a variety of different labs we work with. I work with Create. I work with IVF Canada, hopefully in the near future. And I have my own lab where we really have outstanding results and very, very careful, hands-on, one-on-one care. So it's a bit of a different environment here in our own clinic where we really try and make the overall experience exceptional for all of our patients. We never want anyone to feel like they're a number. We want everyone to feel like they're getting great care. And that they're part of kind of a family of people that are all together helping you along on this journey to build your own family. So the second question we get asked is, how long does it take? And that in large part depends on how long the process takes for selection of an egg donor and a surrogate. But essentially, because CFC and Egg Helpers are very efficient, your legal team is well versed in all of this, it doesn't take that long. As long as we can find you the surrogate and the donor quickly, we are ready to go, usually within a couple of months to do the testing, and then we can proceed from there. So our part is relatively quick, about 2 to 3 months, and the selection process can take some time. Obviously, finding a surrogate that's an excellent match, which is probably the most important part of the journey, does take some time because we want to make sure that you're getting the very best fit for you and you're getting someone that's healthy and that's going to have a good outcome for you at the end of all this. The next question we get asked is about communication. So I actually give my email to all of our clients so they communicate directly with me, and then we have a dedicated team of third-party individuals, which actually seems to constantly expand. So we have a dedicated person at the front desk. We have 2 dedicated nurses now, and it keeps rapidly growing, and we've been adding to that. So there is a whole team available to you, and I always oversee every step so that there's no miscommunication or problems. And if you ever want to have your questions directly answered by me, you're actually getting me instead of a nurse or a coordinator. So I think that can really help a lot of patients feel much more comfortable and at ease. And then the last question we get asked is how much? So we, like most other centers, offer a variety of different packages, and those packages are readily available to look at, and we can send you the price list. And it really depends on what you're looking for. So we have sort of the standard packages where you're just doing the IVF, making eggs and then making embryos, and then doing the embryo transfers. We have live baby guarantee packages, and there's some other packages available for patients that want it as well. And our live baby guarantees break down into 1 or 2 babies. And with those packages, they get the same treatment you would otherwise. We're just reducing the damage financially if it doesn't work by saying, hey, we're going to give you back almost all of your money. We only keep 3,500 Canadian. So a lot of patients, especially if they're overseas, like that because it's almost a guarantee that they're either getting a baby or they're getting their money back. So with that, I'll turn it back to Jordan. And obviously, if you guys have any questions, don't hesitate. Our website, Jordan can link to as well. And we're very active on social media. So you can look at our YouTube channel or our Instagram if you need more info.
Thank you so much, Dr. Victory. And yes, as he said, please, if you have any questions for him, we will be doing a live Q&A session at the end of this webinar. Please throw them into that questions tab. And welcome back, Leah.
Great. So as you've heard from just fantastic experts, I hope that you are gathering lots of questions and developing a curiosity about this process. It is, you know, for us within the industry, it is our daily work. And so we want your questions. We want to educate you. We want to empower you to be the most informed consumer, and really understanding the risks, understanding how to limit risk and leverage great success rates, how to really listen to the doctor, knowing that their success is based on your success. Listening to the lawyer, understanding that their job is not to sell you on the doctor, it's not to sell you on the agency, which is why in Canada it's very different. The agency is singular to the legal professional, to the clinic, and that's because we want to ensure that as you are making decisions, you are making the best decisions for you. And so if, you know, I always judge my relationships with clinics, legal professionals, you know, an 80-20 rule. 80% of the time, it's great. We're working really easily together, and 20% of the time, it's hard. And it's hard because we become so passionate about our clients, and Dr. Victory becomes so passionate about his patients and their care, and that we are all taking care of one another's clients or patients. And so as you are beginning this process, as you are learning about surrogacy and learning about egg donation, it's really, really vital to understand who the people are that do this, because for many clients I speak to, they say, how, like, who does this? Well, let me tell you, without the people that do this, I would have no business. Without the amazing women who show up for intended parents, I would not have had 15 years of living my passion as an agency owner. And so I'd love to bring Racine and Sarah on screen so I can ask them a little bit about you know, their journeys as both a surrogate and egg donor. So Sarah, if I could start with you, if you could just talk a little bit about your experience as a donor, be great.
Hi, I'm Sarah. I have been an egg donor multiple times. I started about 6 years ago. I started egg donation after I had 2 of my own children. They are now both 7 and 9. And egg donation for me was something I was passionate about because a really close friend of mine was unable to have children of her own. And that really hit hard for me because my 2 kids were both unplanned and very easy to get pregnant. And knowing that it was difficult for her and the pain that she had gone through, I wanted to help make a difference in families' lives, to be able to bless them with an opportunity to give them the same gift that my children have given my life. They've changed my world, and I want to be able to give that to many families out there. And it's been an amazing and exciting journey for me.
Excellent. Well, thank you. And I know that, you know, being able to just be a fly on the wall during your last journey and having your retrieval on Christmas Day or Boxing Day or whatever that was just very, I imagine, intense for you and your family. And so we really appreciate, you know, the gift that you've given to so many people. And The question we often get is, does the egg donor feel like that's her kid out there?
I've had a lot of people say that, and for me personally, I equated to if I were to donate a liver or something. It's no longer mine. I'm giving it to somebody else. It's like any sort of donation. So for me, I cut it off at the retrieval date. It's no longer mine, and I'm happy to have that detachment myself.
Excellent. Well, thank you so much. And Racine, if you can share a little bit about your process as a surrogate, that would be fantastic.
Yeah, so I came into surrogacy after being exposed to it for a few years because I work as a doula within my community. So I had an opportunity to support incredible women who were being surrogates and creating families. And the only thing I can compare that moment in delivery to is Disney magic, because it's such a powerful moment to witness a family being created. And so after a few years, when the timing was right in my own life, I decided that I would find some intended parents through CFC. I matched with 2 dads from France who already had a little boy, and I got a lot of questions about, why I would match with them if they already had a child. And my view on that is, I have 2 little girls, so who am I to say that you can only have 1 or you can only have 2? Because they make my life worthwhile every day, and I love to witness them interact with each other. And so giving someone else the opportunity to see that sibling bond was really important to me too. And our journey definitely wasn't flawless. It came with its bumps in the road, but at each opportunity that there was a chance to create a distance with one another, for example, in our miscarriage, we really just leaned into those moments, and it made our connection so much stronger. And at the end of the day, we still have such a fantastic relationship because those moments that had an opportunity to create a distance because we could have just not talked about them or shared how we were feeling because I was experiencing it, but it was also their journey, really created such a close connection. And that was something that was very important to me.
Well, thank you. And thank you, ladies, for sharing bits of your stories. It's, as I said, it's never lost on me that without your participation in our program or surrogacy programs or, for those struggling to build their families. So thank you so much. And it's great to talk to you guys. So I will now just talk a little bit about agency support and, and what we offer and what I hope other agencies are offering as you're speaking to them. And I really want to start with something Ellen touched on, and I know that Dr. Victory works really diligently about as well, and that's safety of all parties. And when I talk about the safety of all parties, I'm talking about the children that are born through surrogacy, the women participating as surrogates and donors, as well as the intended parents' safety, whether it is around the legal process and traveling home safely, whether it is around the health of their babies while they're being carried, and really having the ability to advocate for their unborn children or unborn child. And for us, our goal as an agency is really to create a safe container for the relationships to grow deep. And I always talk about it as a tomato plant. You put the stakes around it so that the plant can grow up, right? We want to grow up and strong, have strong roots. And as you're building the relationship with your surrogate, and if you have a known egg donor who you've committed to and connected with, and you're creating a relationship with her as well, ensuring that the intimacy within those relationships is kept safe. And the way you keep it safe is to have an amazing legal professional handling the legal pieces, having a physician like Dr. Victory to ensure that everyone is safe, that your surrogate is a good candidate. And a good candidate, it's tricky because sometimes you meet someone along the way online or wherever who's lovely and kind, and you can just see her being the one. And sometimes she is, and sometimes she is not. And that is because Dr. Victory's role is to ensure the safety of this woman and the safety of your baby. And so having this container, having this safe container in which you can build this intimate relationship with this woman who is, or women who are going to be such an important part of your life, is key. And so as an agency, it's, you know, for us, it's really insulating your relationship within that container, taking care of the details. So ensuring that you have shared values around selective reduction or termination of a pregnancy, ensuring you fully understand what the wage replacement would be should a medical issue arise and she be required to go on bed rest. Knowing that your surrogate may need support or counseling, and that the agency you work with has an on-staff therapist who will connect and commit to her throughout the journey and up to 6 months post-birth, free of charge included. Those pieces for us are really important. We want to ensure that prior to your match, that container is there, that we have put safeguards in place, that you understand our policies, one of which is not popular often, which is a single embryo transfer program only. I would not put a woman in a plane without a parachute to jump out. And I will not put women at risk in my program of a multiple pregnancy. I also won't put your unborn child or children at risk. I myself have carried twins during a surrogacy. It was beautiful. It was amazing. The girls have amazing parents. It was not a safe pregnancy for me. And I really, in 15 years, made a commitment to create change within an industry that hadn't had change for a long time. And so our single embryo transfer program, having therapy or having a therapist available to our surrogates at all times, having our sacred surrogacy program, really, really honoring the women who participate, you know, in this program, because they are the reason that we have a program. And so in connecting with us, we're going to send you a link. You'll have a consultation with Kim, who will really explain to you what surrogacy is in Canada and what it isn't, because there are some differences in a commercial surrogacy model. There are some differences in the Canadian, you know, sort of medical system around pregnancy and childbirth. And so we want intended parents to be fully informed consumers, as I mentioned earlier, so that as they enter this journey, they have all of the information in order to feel safe, having an agency or a lawyer, physician care for them, so that they can focus on the most important piece of this journey, which is building that relationship, deep, not wide, intimate, caring, connected, committed to the surrogate, and vice versa, to ensure the best outcome. And we know that when women are supported and cared for, when women have the commitment and connection of a community of women, they make the best choices because they're the healthiest. And so for us, that commitment to these women to ensure that your baby is born as healthy as possible, as full term as possible. Listen, life comes up, babies come early, things happen, but we do know that offering the support and commitment to the women is key to the success of our program and the health of your baby. And so I will leave it at that. I'll turn it back over to Jordan, and if we can all come back on screen. I know I've been sent some messages on Instagram, and I think Jordan has some questions for the guests as well.
Thanks so much, Leah, and welcome back, everyone. For everyone else listening in today, now is the time. If you do still have questions for any of our speakers, please send them in using the questions tab. We do have quite a few, so we'll get started. I'll start off. It's a bit of a scenario that they're wondering is possible. They're a couple. One is a U.S. citizen. The other one is from Spain, where they live, and they'd like to know if it's possible to have a family member as an egg donor. She is 24 from Spain, and they've been researching if it's possible to possibly create the embryos in Spain, or if it's an option for her to travel to Canada and go to a clinic in Canada to do so.
Ellen, do you want to take care of the legal, and then I'll talk
Sure. From a legal perspective, there is no concern whatsoever. It is completely acceptable to have a family member be your egg donor. It's just a question of getting the embryos to Canada, which I think Dr. Victory can talk to you about.
So from a medical standpoint, there's also no issue. We would either have the donor come here, or you would have to make the embryos elsewhere and ship the embryos here. We would just have to make sure that the sperm is being used from the partner that is not related, obviously, to the woman, because you couldn't, if it was two men, they could not share an egg donor, because if you're related, there's going to be genetic issues, obviously. So as long as there's no relationship in terms of blood ties, or what we call consanguinity, then yeah, there's no problem at all. We can help out in that regard. In terms of the law, as far as I'm aware, and Ellen, you can definitely speak to this, it's actually relatively difficult with Health Canada to import eggs. We would have to have an institution that has been approved by Health Canada from outside of Health Canada do that, and there aren't any. But we can bring in embryos. We just need certain criteria to be met, like sexually transmitted disease screening. Great question.
Okay, thank you. The next question, I believe, is also for Dr. Victory. The intended parent was wondering if it's possible for an HIV-positive treated intended father to give sperm for a surrogacy to create those embryos.
Yeah, it's definitely possible. So the risks with doing IVF of HIV transmission are actually very, very low. And there are ways to support the surrogate through the journey that minimize the risks. It would be up to the intended parents and, in this case, CFC or whichever surrogacy agency you're working with, to identify a surrogate who recognizes that there is a risk, but that it is very, very small. And as long as the surrogate is willing to accept that risk, we would then take every precaution necessary to minimize the potential that that surrogate would acquire HIV. The risk is actually less than 1% based on studies. So this has been well explored. There's lots of literature on this, and we would feel comfortable helping out as long as everyone was, well aware of the risks and the potential outcomes. And again, it's really reassuring when you tell someone your risk is less than 1%. So it's not something we've had trouble with in the past.
From a legal perspective, the surrogate just has to consent, and there are lots of surrogates who are very comfortable with caring for HIV positive, with carrying an embryo created with sperm from an HIV positive man, trace amounts. And I think that, Leah, you can talk about the amount of surrogates who are willing to do that.
Absolutely. Jordan, can you please look for or Google so that we can get it sent out to this particular person? There was a great blog piece by the US surrogacy agency Growing Generations, and it followed many people, HIV positive people, who had surrogates carry for them, and that there had been zero transmission. What is really important for me is that, as I said earlier, that everyone is an informed consumer, and that includes the surrogate. And so what we ask Dr. Victory or clinicians to do is to find an infectious disease specialist who can connect with the surrogate, just do a quick consult, and explain to her what it really would look like. We have many surrogates currently and in the past who have carried for HIV positive clients, who have done the research, who are really comfortable talking to other women about their experience. And it's really been inspiring to see women showing up for clients who really thought that a genetic child of their own would not be possible due to their HIV status. And so we would work in conjunction with Dr. Victory. We also suggest a bit of language in the contract that just says the surrogate has had this information and was making an informed choice. And absolutely, we would love to connect with you personally to discuss your, your moving forward and becoming parents.
Great, thank you. Yeah, and just to let everyone know, I did pop that link that Leo was mentioning about into the chat box for everyone.
Thank
Now,
you.
the next question, we have some intended parents from Australia. They already have their embryos created. They were wondering how easy is it to move them from Australia to Canada?
I guess I can answer that one. It's very, very easy. We just need sexually transmitted disease screening results, and as long as the embryo quality is okay, and that's something that our lab director would review, there are a variety of different agencies which can ship the embryos, and we've actually received embryos from Australia several times now. We've never had any issues with it. It comes in a very small tank, which has liquid nitrogen in it. It's brought by FedEx. It gets here right away. The tank has a thermometer built into it with an alarm system. They're encased in a very stiff metal tank, and then that inside it has a plastic sheath which is holding the embryos inside of a glass tube, and then all of that is encased in plastic as well, so it's virtually indestructible. So we've never had any problems shipping embryos anywhere in the world. We get them from the US, from Australia, from Europe. It's always worked flawlessly without any concerns at all.
Okay, that's wonderful. Thank you. And on the other side of that, we have a question here. They haven't identified which country they're from, but they haven't created their embryos yet. They were wondering if it's possible to send their sperm to Canada to create those embryos, or if that's something where they have to travel into the country.
Yeah, so actually we have a robust program for shipping sperm back and forth from anywhere to Canada. So that's something we're doing commonly. So we get blood, sperm, and urine, and we get the samples overnight or within 2 days. We send out a kit that the patients can use to prep all of that. And obviously we discuss everything with them ahead of time. It's very well organized. Then we have the blood and sperm and urine come back. Everything gets processed in Canada, and that way if you need an egg donor in Canada, we can use your biological specimen, your sperm in this case, with that egg donor, and that's how we've been doing it. So you don't have to come to Canada at all, not unless you want to be here, and that's great, but currently it's a bit difficult just because of the current restrictions with COVID. I'm sure in the future it'll be easier again, but right now we just recommend that you send the sperm. There's no need for you to be here.
On the legal side, I would actually go so far as to say that COVID has been a benefit in this regard, because there used to be a more common practice of coming to Canada to donate, and we're realizing that it's just as safe and doesn't require 2 weeks of travel in order to get the sperm to Canada. And so there's some significant cost savings there as well.
Okay. That's great to know. While we're on the topic of embryos and traveling, we have another question here. It's an intended parent who has a friend willing to be their egg donor, but it's not possible to create embryos in their home country. I guess they're in the Netherlands. So would she need to go and stay in Canada while undergoing the treatment leading up to the egg collection?
Well, she would need to be here for the egg collection, and we'd probably want her here at least a day or two in advance. There is testing we need to do for that donor in Canada. So yes, it would be easier if they were here for about a week or two ahead of time. We can get the testing done within about 2 weeks. So as long as they were here for 2 weeks, we could do the testing, the screening, everything that's necessary, and then also have the cycle run at the same time so that it's really efficient and efficacious for those clients. So they would need to be here. They don't have to be here for a very long time, but they would need to be here for a short period of time, and we could manage their cycle at the same time as the testing.
Okay, thank you. Okay, so moving on, we have a few questions here regarding insurance for Ellen, insurance for the child. So they were wanting to see if you could expand a little bit more about what those options are. And the second part is we have another set of intended parents who have had, they've spoken to a couple of intended parents who have had their baby in Canada through surrogacy, and they were unable to confirm that they had insurance which covered the baby. They are wondering how foolproof is insurance for baby as Australian parents. Their concern is regarding if the baby would need to spend time in the NICU, for example. They would definitely want to be covered, and they just are looking for some more information about that.
So the answer is, I talk about insurance all the time. I would encourage them to reach out to me directly. I have an information sheet on the one policy which is available. So starting with Australian clients, the one policy that is available is a policy through a company called Allianz. What they will do is they will cover against NICU care for an infant, for a baby born premature or with medical complications. Look, I had a baby born 2 years ago at 26 weeks while the surrogate was driving her car. The intended parents were overseas. We had a spontaneous birth. There were helicopters full of very high level specialist doctors who came in. Baby was extremely well taken care of, as they all are in our healthcare system. The bill was very, very high, and Allianz took care of 100% of it. There are specific details about the policy. The policy does need to be in place a minimum of 2 months prior to the first transfer. It will only last a year. The premiums are about $4,000 US, and they will cover your baby. There's no question about that. There are certain residency issues which I'm happy to explain to you, but we've been working those out over the past few years with the underwriter for the policy. So it is, to describe it, yes, it is foolproof. Yes, it will cover your baby. Yes, it is necessary, because the one concern that Canadians have, and frankly, Canadian taxpayers have, is having a very premature baby born here who incurs significant hospital expenses, and then essentially leaving the Canadian taxpayer on the hook for that bill. That is a major sensitivity, and the insurance is mandatory. With respect to clients from other countries, if you're from the United States, I typically recommend that you investigate insurance with your own insurer ahead of time. And with other countries, it really depends on whether or not you've got access to private insurance. Most of my European clients, most of my Australian clients do not have access to other insurance, and so they typically do need to use the Allianz policy. So at a high level, yes, it is available. Yes, it is necessary. Yes, you need it to protect yourself against healthcare costs for a NICU baby. And I'm happy to speak to anybody about this issue directly and confidentially.
I'd like to also add that, my goal is different than Ellen's. Ellen's is to protect the client. And in this case, speaking to an intended parent, my role is to protect the surrogate. And so in order to become matched in our program, we require proof of insurance. And we really hope, if you're shopping agencies or speaking to agencies, that they are really giving you the sense that they have the same requirement. We provide that information to Dr. Victory's staff or to whichever clinic staff you're working with. My goal is to never put someone in a position I wouldn't want to be in. And listen, you have an early baby and they can't find you, they're looking for a surrogate to put a bill on. And this woman has just done this amazing thing for you. And I don't want to ever put her in that position to receive a NICU bill. And as Ellen said, she had a client a couple of years ago. Ellen and I have been working together over 10 years, and we've had $1.5 million bills. We've seen it all. And, we are so passionate about insurance. We want you to feel safe, as I said at the beginning, that this safe container is there, so that as you build on your family, whether it's creating embryos, then finding the surrogate, then achieving a pregnancy, and then having a baby, that all of the details are there. All of the stakes are in place to hold it all together. And insurance is just so important. And this insurance does not cover twins, which, again, I have a single embryo only program. Do twins occur? Last year we had one set of twins. out of 300 pregnancies. And so we felt that was a win. Embryo split, you know, sometimes that happens. But it really, really is important as you're researching that you aren't just, you know, can I get a surrogate? Can she get pregnant? Can I have a baby? But that all of these details that Dr. Victory speaks of in terms of the medical testing required and the legal, you know, sort of parameters that Ellen's discussing are just so, so important in keeping your baby safe, your surrogate safe, and you financially in a position that you can purchase diapers when you get home with your baby.
The only thing I'm going to add on that is that having a NICU baby is terrifying. Having a NICU baby in a foreign country is terrifying. And being afraid every time a doctor walks in the room that you're going to be handed a bill is terrifying. Buying the insurance takes that away.
Thank you, Ellen. Okay, we have a few sets of intended parents here who have created their embryos in US clinics, and that's currently where their embryos are at. They're wondering what the current processes are with Canadian surrogacy using a US clinic, and does this affect the timing for finding a surrogate and the process?
So we are suggesting to all of our clients who have created embryos in the US to do one of two things. The first one is to, the first piece is to speak to your clinic in the US to share with them your concern around the border closures, the mandatory quarantine, the additional costs that they would incur should they have and risk that the surrogate would be required to take should she travel to the US. Then to investigate what the cost would be to ship. My suggestion is 2 to 4 embryos to Canada. The reason I suggest 2 to 4 embryos is that then you will have, if you have more than that, you know, if you have 8 embryos, that you would leave some there for a subsequent journey if you are planning on having more than one child, so that you can hopefully still participate in their guaranteed program that you have paid for, to really limit additional costs here, there, and everywhere. So if your clinic is willing to release 2 to 4 embryos, that you would ship them, have them shipped to Dr. Victory, and you would enter into his program with a Canadian surrogate. The remaining embryos would be there for a sibling journey or subsequent journey. We are finding it tremendously difficult, and in fact are not currently taking clients that are working with US clinics, as you know, it all goes back to that safety piece. My, you know, greatest desire is to keep women safe. And right now with COVID and travel to the US, the requirement for these women who often live in small communities, having to have them quarantine post embryo transfer outside of a community in which their families are is very difficult. Yes, they can't in fact interact or see their family for those 14 days, but knowing that they are close is important to them. And if it's important to them, it's important to me. And so we are currently closed to clients who have embryos in the US, unless they are willing to move some or all of those embryos to a Canadian clinic. And I will tell you without hesitation, and listen, I don't do success rates, I have no buy-in anywhere, but I will tell you that our clients who have moved their embryos to Canadian clinics, embryos that were created in the US, have an equivalent or better success rate than those who have had embryos created in clinics in Canada. I mean, it has been the same or better. And so, Dr. Victory, I don't know if you want to talk about, you know, how you have sort of navigated this piece, but for me, for my surrogates, the women I care for and support, we are moving to a Canadian model currently.
Yeah, I would echo pretty much everything Leah just said. So I think traveling for a Canadian surrogate to the US these days it's virtually impossible. The amount of quarantining necessary going there and then coming back is very difficult to navigate and would be exorbitantly costly and difficult, emotionally difficult, physically difficult, you know, just work related difficult. It's too complicated to do. So getting embryos shipped, we do every day. I see pretty much at least once a day or once every couple of days, we're receiving embryos from some clinic in the US or elsewhere in the world. So that part we've really got down without any problems. And then once the surrogate is within Canada, traveling within Canada is quite easy. So we can get the surrogate here and then do the embryo transfer here. Success rates, I mean, obviously it depends on the quality of the sperm, the egg, the embryos, but I'm really proud of our team and that our success rates are incredible. And it is extremely rare that we need to do more than 1 or 2 embryo transfers to succeed. So we've had a very, very good program. I have to say, if you go on my YouTube channel, you'll realize every week we run a show where we explore fertility facts and fictions with patients. And so I'm constantly studying, constantly looking at what's best. And we've got a really outstanding frozen embryo transfer program, which really maximizes our success rates. So right now, our average for all of our patients, including patients doing their own IVF, is just over 80%. So we're doing really well, even with just 1 embryo. And as a result, we're very comfortable taking embryos from elsewhere and doing transfers for you. So sending a surrogate from Canada to the US, I would not support either. I agree wholeheartedly with Leah. But sending your embryos to Canada is easy and can result in a very, very good success rate.
Can I also add that surrogates are comfortable traveling to a different province. And so Dr. Victory is in Ontario. If your surrogate is in British Columbia or Alberta, they are prepared to go to Toronto. The government's current estimates on when we will all be vaccinated in Canada is end of September, and most of their current estimates have so far not been accurate. So it's quite possible that if you're waiting for a surrogate to travel to the US, you will probably be waiting throughout 2021.
Yeah, and very quick follow-up. It's the coming back part that's also difficult. The US has now said that if you're vaccinated, you don't need to quarantine going into the US. But coming back into Canada, even if you're vaccinated, you have to spend 3 days in a hotel, wait for your vaccination status or your COVID swab status to come back, and then you still have to quarantine for 2 weeks, even if you're negative. So there's a 3-day hotel stay, there's 2 weeks of quarantine. I mean, the costs would be staggering, the financial toll is heavy, the emotional and psychological toll is very heavy. And they're doing it intentionally to stop people from traveling. So it's much easier for your embryos to travel because they don't need to be quarantined than it is for the patient to travel.
Thank you so much. We just have, I personally have one more question from intended parents who are on the very beginning of this journey. They haven't started, they saw our webinar, they wanted to join. Maybe this question's for Leah. What's their first step? What should they be doing to get started on the process?
Absolutely. So at the end of this webinar, you're going to receive not only a copy of this webinar to sort of look back through sort of the finer points that you may have missed. You're going to have contact details for Dr. Victory, and you're going to have contact details for Ellen. Listen, I love to be the first point of contact, but it's not necessary, nor is it prudent. I think that talking to the doctor first to make sure that you are able to participate, that if you are a male same-sex couple, that one of you is able to genetically contribute to the creation of embryos, if that's important to you. If you are a heterosexual couple and, you know, mom, it's important for you to use your own eggs, to know that you can do that. And so having that conversation with Dr. Victory first, and to really look through, you know, what makes sense for you in terms of proceeding. Testing can be done in your own country, and Dr. Victory can sort of tell you what you need to have done if you live abroad. And then I think talking to Ellen and getting a referral to a lawyer in your country. Ellen knows all the things about all the Canadian laws, but I personally want you to know that you can get home with your baby, and Ellen knows the people literally everywhere. And she'll be able to refer you so that you can have a conversation with a lawyer in France or Spain or Germany or Australia to really ensure that you are engaging safely. Again, safety is key to this process. You feeling safe, you feeling cared for, you understanding and being an informed consumer from the very beginning. So I would say as you get the notes from the webinar and the contact details, to connect with Dr. Victory and Ellen, and then reach out to us. We'd love to share with you as well, just the surrogacy and donor process if required.
Amazing. Thank you, Leah. Were there any other questions that you had submitted that you wanted to ask?
Let me just quickly double check. The only question I have is for Ellen. I know the answer to this, but Ellen, I'll ask you. Is Canada able to accept intended parents legally from any country?
Yes, we don't, of course, we don't discriminate against anybody anywhere. Everybody is welcome. And the one other thing, and this doesn't come up very often, but if for whatever reason you are not in a position to be genetically related to your child, because, for example, you're a couple and you both have cancer treatment or have had cancer treatment, we can also work with non-genetically related embryos.
Absolutely, and that's a great point. If you are listening to this webinar and you are in a position that you aren't creating embryos but are interested in embryo adoption, or picking up embryos from clients that have achieved their family, please reach out to us as well. There are options for everyone, and our goal is for you to have a family, and that will happen in the way that you are meant to have a family. And I know that Dr. Victory, Ellen, and myself will absolutely just come alongside and support you through your family building, and in the safest way possible in Canada. So thank you everyone for being a part of this webinar, and we will get our contact details out to you and look forward to hearing from you very soon.
Thank you, everyone. Thanks so much, Dr. Victory and Ellen, for joining us. And
Thank you very much.
Have a great rest of your day or evening, wherever you are.
Thanks for having us. Take care.